This lecture is a brief introduction on medical terminology, which also known as language of medicine. Let's start with some basics. Some medical terms have an unfamiliar combination of vowels, for example the vowels A and E in a word, like bursa. As a general rule, remember, every time you have two vowels after each other, pronounce the word with the sound of second vowel, bursa. Or, pluri. Or, Röntgen. The next thing to know about reading medical words is for letters C and G. Let's look at some examples. Cerebrum, cardiac, geriatric, and gastric. As you see, the letter C is pronounced K if we have the letter A after it. Cardiac. The letter G is pronounced as gay when the letter A comes after it. Gastric. Beside the vowel A, if we have vowel O or the letter R, we also pronounce C as K and G as gay. Like in words, cord or crude. And in words, gonad or grade. Now let's look at these words, epigastric, gastralgia, and enterogastritis. As you see, all of them have a part in common. Gaster. Gaster is the root of all of these words. So basically, the root is the foundation of a word, regardless of other parts attached to it. Gaster is a Greek word, and means stomach. In the word epigastric, epi, which means above, or upon, is a prefix. And ic, which means belong to, is a suffix. Then epigastric means the area above the stomach. And gastralgia means pain in stomach, or stomachache. But enterogastritis is a different word. And entero is not necessarily a prefix. Here, enter is also a root and means the intestine. As a general rule, anytime we use two roots right after each other, we use the letter O, and sometimes the letter I, to combine them. We call it combination form. The suffix itis means inflammation. So, enterogastritis, or also known as gastroenteritis, means inflammation of both stomach and intestine. Thank you for listening, and your feedback will be appreciated.